Imagine the discomfort. Itchy, peeling skin, thickened, discolored nails, a persistent fungal infection on your feet and toes that just won't go away. It's more common than you think, and tackling it effectively means understanding what causes it and how to fight back. This isn't about magic cures, but about proven strategies, simple home remedies that actually work, and the crucial steps to prevent it from returning. We'll break down the science in plain language, show you exactly how to prepare and use natural treatments, and guide you through the journey of regaining healthy feet. Stay with us to discover how to finally say goodbye to nail fungus and foot mycosis, and what to do if things don't improve. Causes and symptoms of nail fungus and foot mycosis. Fungal infections of the nails and feet, commonly known as nail fungus and athlete's foot, thrive in warm, moist environments. Think about sweaty socks, damp shower floors, or even shared gym equipment. These microscopic organisms, often dermatophytes, are adept at invading the skin and nails. They feed on keratin, the protein that makes up your nails and the outer layer of your skin. This invasion leads to a cascade of unpleasant symptoms. The onset of nail fungus might be subtle. You might first notice a slight discoloration, perhaps a yellowish or brownish hue, at the tip of your nail. Over time, this color can deepen. The nail may also thicken, becoming brittle and crumbly, making it difficult to trim. In more advanced stages, the nail can separate from the nail bed, a condition called onycholysis, and you might experience pain or discomfort, especially when wearing shoes. Athlete's foot, on the other hand, typically affects the skin between the toes. It often begins with itching and stinging, followed by redness and scaling. You might see small blisters or cracks, particularly on the soles of the feet or along the edges of the toes. The skin can become dry and flaky, resembling dandruff. If left untreated, the infection can spread to other parts of the foot or even to the toenails, creating a dual battle against the fungus. These infections are highly contagious. Sharing personal items like towels, socks, or shoes can easily transmit the fungus. Public places like swimming pools, locker rooms, and communal showers are notorious breeding grounds. Even direct contact with an infected person can pass the fungus along. Understanding these transmission routes is crucial for prevention and for stopping the spread within your own household. Conventional and home-based treatment options. Fungal infections of the nails, often referred to as onychomycosis and athlete's foot, or tinea-pedis, are common conditions caused by microscopic organisms called fungi. These fungi thrive in warm, moist environments, making feet particularly susceptible. They can enter the skin through tiny cuts or abrasions, or directly through the nail bed. Overcrowded, humid spaces like locker rooms, swimming pools, and even tight-fitting shoes create ideal breeding grounds. Poor hygiene, excessive sweating, and a weakened immune system can also increase your risk. The visible signs typically start subtly. Nails might thicken, change color to yellow, brown, or white, and become brittle or crumbly. Athlete's foot often presents as itching, scaling, redness, and sometimes blistering between the toes or on the soles of the feet. Conventional treatments for nail fungus and athlete's foot usually involve antifungal medications. For mild to moderate athlete's foot, over-the-counter creams, sprays, and powders containing ingredients like clotrimazole, miconazole, or terbinafine are often effective. These work by either killing the fungus directly or inhibiting its growth. It's crucial to follow the product instructions carefully and continue treatment for the recommended duration, even after symptoms disappear, to prevent recurrence. For more stubborn or severe cases of athlete's foot, or for nail fungus, a doctor may prescribe stronger topical or oral antifungal medications. Oral antifungals, such as terbinafine or itraconazole, are generally more potent but require a prescription and can have side effects, so they are usually reserved for more significant infections. Nail fungus, in particular, can be challenging to treat with topical medications alone because the fungus resides deep within the nail. Alongside conventional medicine, numerous home-based remedies have been used for generations, often leveraging the natural antifungal properties of certain substances. One popular approach involves using vinegar, either apple cider or white vinegar. The acidic nature of vinegar is thought to create an environment less hospitable to fungi. To prepare a vinegar soak, mix equal parts vinegar and warm water in a basin. Submerge your feet for 15-20 minutes daily. After soaking, thoroughly dry your feet, paying special attention to the spaces between your toes, as moisture can prolong the infection. Another commonly cited remedy is tea tree oil, known for its potent antifungal and antiseptic qualities. Dilute a few drops of tea tree oil with a carrier oil like coconut or olive oil to avoid skin irritation. Apply this mixture directly to the affected nails or skin twice a day. Always perform a patch test on a small area of skin first to check for any adverse reactions. Other home treatments include using Vicks VapoRub, which contains camphor and eucalyptus oil, both with antifungal properties, or applying a paste made from baking soda and water. For the baking soda paste, mix enough baking soda with water to form a thick paste. Apply it to the affected area. Let it sit for about 10-15 minutes, then rinse and dry thoroughly. While these home remedies can offer relief for some individuals, especially for mild cases of athlete's foot, it's important to manage expectations. They may take longer to show results compared to prescription medications and might not be effective for severe or deeply ingrained nail fungus. Consistency is key with any treatment, whether conventional or home-based. Maintaining excellent foot hygiene is paramount throughout the process. This includes washing your feet daily with soap and water, drying them completely, changing socks frequently, especially if you sweat a lot, and wearing breathable footwear. It is always advisable to consult a dermatologist if your symptoms are severe, persistent, or if you have underlying health conditions like diabetes, which can complicate fungal infections and their treatment. A healthcare professional can provide an accurate diagnosis and recommend the most appropriate course of action for your specific situation. Preventative measures and lifestyle adjustments. Preventing nail fungus and foot mycosis hinges on consistent hygiene and smart lifestyle choices. Keeping your feet clean and dry is paramount. After showering or bathing, thoroughly dry your feet, paying special attention to the spaces between your toes. Fungi thrive in moist environments, so dampness is their best friend. Wearing breathable footwear made from natural materials like leather or canvas allows your feet to air out, reducing sweat buildup. Avoid tight shoes that can trap moisture and create a warm, inviting climate for fungal growth. Changing your socks daily, or even more often if your feet tend to sweat heavily, is a simple yet incredibly effective preventative measure. Opt for socks made of moisture-wicking materials like cotton or wool. If you have a history of fungal infections, consider using antifungal powders or sprays inside your shoes and on your feet as an added layer of protection. This helps to create an environment that is less hospitable to fungal spores. Always choose footwear that fits well and doesn't rub or cause irritation, as damaged skin can be more susceptible to infection. When visiting public places like swimming pools, gym locker rooms, or communal showers, always wear waterproof sandals or flip-flops. These areas are notorious breeding grounds for fungi. Sharing towels, shoes, or nail clippers can also spread fungal infections, so it's crucial to use your own personal items and avoid lending them to others. Regular inspection of your feet and toenails for any early signs of change, such as discoloration, thickening, or brittleness, allows for prompt intervention before an infection takes hold. Maintaining a healthy immune system also plays a role in your body's ability to fight off infections. A balanced diet rich in vitamins and minerals, adequate sleep, and regular exercise contribute to overall well-being, making you less vulnerable to various ailments, including fungal infections. If you notice any persistent changes in your nails or skin, it's always best to consult a dermatologist. They can accurately diagnose the issue and recommend the most appropriate course of action, which might include prescription-strength topical or oral antifungal medications if home remedies are insufficient. So, to recap, nail fungus and foot mycosis often stem from moist environments and weakened immunity. Simple hygiene like keeping feet dry, wearing breathable shoes, and avoiding public wet areas are your first line of defense. For home remedies, remember that consistency is key. Diluted tea tree oil, for instance, can be applied twice daily after washing and drying the affected area. Just a few drops mixed with a carrier oil like coconut oil is enough. Another option is a warm foot soak with Epsom salts and a splash of apple cider vinegar, followed by thorough drying and application of a natural antifungal cream. Be patient. These treatments can take weeks or even months to show significant results as the healthy nail grows out. Always trim affected nails straight across and avoid sharing personal items like clippers. If your condition is severe, doesn't improve, or spreads, please don't hesitate to see a dermatologist. They can offer prescription treatments and personalized advice. Remember, a healthy foot is a happy foot. Next time, we'll dive into how to choose the right antifungal shoes and socks to keep your feet protected. So stay tuned.